Hello, I'm Stephanie Mandeville, NEA Rhode Island Communications Director. Today is Friday, February 12th, and this is Ask Larry and Bob, and I am joined, as I am each week, by Larry Purtill and Bob Walsh. Hello, gentlemen.
Good morning.
Jeff.
Happy Friday.
Yes. Happy Friday before February vacation for many people.
Yes, for many, yes. It's been a while since we've met in this forum, actually, but we've been very busy. And so as we were trying to put things together for this episode, which will be brought to you by the letter P, as it turns out, we're going to talk about a few things, starting off first, obviously, with the pandemic. NEA National did a survey of members this week, that was released this week, I should say, on Monday. And the central theme of that obviously was members' vaccination rate and access to the COVID-19 vaccine. Top lines, 82% of educators have not been vaccinated, as we know here. And 85% believe that educators should be prioritized to receive the vaccine. Now, there were some other things in there that I think were super important, which is it's not just about vaccines. It's about keeping up with those mitigating factors of masking, sanitization, and distancing. So having looked through all of the data from this member survey, Bob, do you want to give some of your thoughts on that?
Sure. Thank you. I had the opportunity last week in Lively Experiment to further explain our position, another P, on the vaccines and the pandemic. And I think we finally gotten to the point where we've got a clear and consistent message on this. And really what we're doing is talking about vaccine distribution from our perspective as divided into two parts. The first part is get the vaccine to the people who are at risk of, let's be blunt about this, dying if they get the disease. And the data shows that over 75 years of age and then over 65 years of age should be priority groups. You also, in the same vein of trying to prevent fatalities, want to make sure that your first responders, that your direct service providers to folks in those age groups, the caregivers, the folks who work in the nursing homes, and everything else are provided for. Rhode Island has also taken an additional slant of talking about communities where transmission rates are high, but that does seem to be changing, ever changing, as the data comes in every week. And there's shifting communities that have the unfortunate distinction of being at the top of the list. But in any event, the first tranche, whether you call it a tier or a phase or anything else, should be preventing fatalities. Where we disagree with Dr. Alexander Scott is that the scheme that she has promulgated after that is to continue to move the vaccine distribution down age cohort by age cohort. Our reading of the CDC guidelines, and everyone can do their own research, and certainly the evidence that's coming in already from about half the states in the country, is that after those avoiding fatality groups get the vaccine, the next groups should be front-facing professions, including educators, teachers, and education support professionals. And there are two reasons for that. One is exposure to symptomatic and asymptomatic cases, as in contracting the disease. And the other is, specifically to education, if you want to keep the schools open, which Rhode Island has been fairly successful in most communities in doing, you need people there. And just this week, we have found out that the new guidance says after you're vaccinated, for at least a 2.5 month window, 2 weeks after you get your second vaccine, and for 2.5 months after that, even if you're exposed to COVID, you do not have to quarantine, which means if you are a teacher, an education support professional who was fortunate enough to have been vaccinated, even if you're exposed, you can keep teaching. Now, I'm pretty concrete, sequential on these issues. That seems understandable, logical, and should be adopted as public policy in Rhode Island. Fortunately, incoming Governor McKee has asked me to serve on his COVID task force, which I do. So I will have the opportunity to articulate that position and other positions in defense of our students and our educators. Just earlier this week, we had one of those task force meetings, and Dr. Alexander Scott talked about the need to get better masks, either double masking or KN95 masks and the new technology, and that would be their recommendation. So I posed the question, how are you going to get these masks to students? Obviously, we need them for the educators as well and all other professions, but students, especially in our urban core communities, but spread throughout the state, might not have the ability to access this new equipment. And we know how hard it is for students to keep their masks on all day anyway. All of you on the front lines know. And right now, there's not an adequate answer to that question. So I will continue to advocate our position. But if you need the quick explanation of our perspective on this, which matches CDC guidelines, which matches what a majority of the other states in the country are doing, is after you take care of the most at-risk folks, educators should be treated as a group, not by age cohorts, but after the at-risk groups, highest at-risk group are taken care of, we should be on the list as a group. And right now, Dr. Alexander Scott does not agree with that, but a lot of medical experts do. And we will continue to advocate for that particular position on all of your behalf.
Larry, we're expecting CDC guidance to come out today that's going to inform the reopening of schools. We don't know what it's going to say, but we can sort of assume based on what President Biden has put forth that it's going to be not just vaccine related. It's going to talk about those mitigating factors. Can you talk a little bit about this sort of holistic approach that we're going to have to take?
Yeah, and it's certainly the holistic approach is exactly what we've been talking about and exactly what NEA has been doing. We had Becky Pringle, the NEA president, join our executive committee this past Monday, and she talked a lot about that and give certainly kudos to her for her effort in reaching out to the White House, the CDC, and everyone involved. She's in constant communication, pushing our agenda and for our members, and most importantly for our students. And part of that is this whole approach Bob talked about. It just makes sense that if you're going to go back into in-person, you don't have to quarantine for 2.5 months after the vaccine, then let's vaccinate all teachers and all staff, because one of the major issues here is lack of staff, and that's why often schools have had to shut down. But looking at the whole approach, the mitigation approach has to continue. People still have to wear masks. There still have to be social distancing. There still has to be ventilation, quality ventilation. We need a lot of infrastructure to be replaced and to be rebuilt as we move forward. And that takes us into, once we return all in person, what is school going to look like going forward? And how do we, I hate to use the term catch up or learning loss, but how do we get students from even before the pandemic, but how do we bring them up to where they need to be and to move forward? And it's not going to be a 1 month or a summer program. It's going to be a couple of years moving forward. So educators need to be part of that process. RIDE came out with their plan the other day. Bob and I have been working with a group that the press release will go out later, but we met with RIDE, and basically it's, how do math, literacy, how do we provide programs for students that need that starting almost immediately? How do we combine that with social emotional needs and other needs? How do we get that information out to parents that programs are available? How do we work with community groups? And most importantly, make sure that it's done at the local level for local educators that are involved, because they're the ones that know their students the best. So this is we have urgent needs over the next few weeks around vaccinations and making sure mitigation plans continue to be in place. One thing we're doing pretty good in Rhode Island, if not very good in some places, is the whole testing issue and following up of that to make sure schools are safe. But this is just part of a long process. And that's what I think people have to understand, we're not going to flip a switch once everyone's vaccinated and, well, everything's back to normal. No, it's going to have to take months, if not years, and it needs to start immediately, and that's what we're working on.
I think we're seeing that it even, you know, if the CDC guidance that comes out, we're already seeing a federal level plan. I mean, we haven't seen that through this entire process. To have just the president coming out to talk about vaccines, that he's secured 200 something million vaccines, that we could all be vaccinated by July, which is amazing. So I feel heartened that we're actually getting some sort of, you know, concrete information from the federal government, which is going to keep things.
It's wonderful. There is absolutely a positive goal, positive outcome within the foreseeable future. This is, since we're here, sponsored by the letter P in this show, this is a prior planning prevents poor performance opportunity. And unfortunately, the prior presidential administration did not really give the guidance, but President Biden is all over this and his people are all over this. We have to make sure that we are able at the state level to use the same philosophy. This is in the work that the Rhode Island Department of Education is doing. We cannot let the philosopher kings and queens mess this up with a lot of rhetoric and 30,000-foot overviews when we need a practical on-the-ground plan to address the pandemic-related educational issues starting as quickly as possible. It's not just a summer project, it's a summer, fall, next summer, and forever.
This is triage.
It's triage.
You have to be able to triage, and then once that is implemented, that's going to give you the foundation to build it out and move forward with a more, you know, comprehensive.
And it is absolutely fine to also talk about the greater implications and the bigger picture issues, but not to the point where they interfere with the necessary action and planning so that we can get something moving as quickly as possible, especially in a world where hopefully we're going to have fairly widespread vaccinations in place. So, which
would be nice. So Larry, you mentioned we did have our executive committee meeting on Monday night with President Pringle, who's extremely passionate.
She is.
To just bridge over to another P, we did have a question that was brought up during the executive committee meeting about pensions. So Bob, do you want to kind of outline a little bit what that was?
The very smart Lisa Wood, who is the president of the Middletown Teachers and has been for quite a while, raised a very interesting question about the impact of all of this on pension accrual. It's a little technical question because the year is shortened. They had an issue once in Middletown where they were given the blessing of doing a school year that was less than 180 days, and it messed up the computer systems over at the employee retirement system of Rhode Island, and it took a lot of work to get it fixed. And she raised the question, and we are getting we absolutely believe we will get a favorable answer to this year counts as a year. They're not going to say, well, it was only 175 days, therefore you don't get a full year's credit. But we have not gotten that official answer from the treasurer's office yet. They pointed to something in the law that actually is specific about pandemics, and that's great. I can read the law as well as everyone. We need a definitive answer from either the treasurer's office or the governor's office or the General Assembly so that it is not something that anyone need worry about. I am absolutely convinced we will get that answer. We do not have it yet, but we will be relentless in pursuing it and report back when we have something definitive. And thank you to Lisa Wood for lying awake at night thinking about all the things that could go wrong and bringing them to our attention so we can fix them in advance. So that was a good catch, as we used to say in negotiations. Hey, that's a good catch, on the possible implications of language. And this was a very good catch. So gives us time to make sure it doesn't harm anyone.
Good. I'm going to take a break before we go into the next segment. I want to talk a little bit about professional development. It's a little advertisement. I want to remind folks, and I'll put the links underneath the video in YouTube, that the Reading Across Rhode Island book is stamped by Jason Reynolds and Ibram X. Kendi. And they've already had an evening for educators. I think it was either earlier this week or last week, but there is another one coming up. And then there's an author event with Jason Reynolds. I think it's coming up in April. And you need to register for all of that in advance. We have released, and by we, I mean Tabitha Watson, who's amazing. The spring book study is The Deepest Well by Nadine Burke Harris. Some folks have already, when I posted that to Twitter, some folks already said they couldn't believe how amazing this book was, transformative read. So that sounds really interesting. That's just kicked off. Registration is available for that, and you get a free copy of the book. Upcoming this spring also is another implicit bias training. No date for that yet, but that's coming. And also the Racial and Social Justice Committee is putting on a panel on February 25th for anti-racist advocacy in education, which sounds fascinating to me. So those are all things that are upcoming, and you can look underneath this video. You'll see the links that you can register and get more information. So one of the other P's that we were talking about is to encourage folks not to panic. And that comes in two forms. The first form is a little self-care. So Larry, you're going to take that branch of it first.
Well, next week being school vacation for many of our members, I certainly encourage everyone to take a little time, a lot of time for yourself. I know we're now approaching a year. It'll be a year on March 13th. And it's been a long year for everybody. And we keep talking about self-help, and some people will say the best self-help we can get is to take some of this burden off of us. And we're working, day and night. That's what keeps us up at night to figure all that out. But you need to take a little time for yourself, your family, whatever. It's going to be a little snowy next week, but go tubing, go for a walk, read a book, whatever helps. And there is a light at the end of the tunnel here. Where everyone's going to be vaccinated. We're talking about what moving forward for both our members and for our students. So take a little time for yourself and your family. And if you do have to work next week, Monday's a holiday. Try to take a little time. And there's nothing wrong with at some point just saying, no, I need a few hours to myself. So certainly encourage you to do that. It's and some of our professional development is that's for a lot of you, that's relaxation and helpful. And so take a look at that. It's and you get to be with other people and talking about something besides just vaccines.
Bob, speaking of vaccines,
which I dream about all the time now. Vaccines are in my
vaccines.
Yeah. What's the other branch of don't panic? There is, as Larry said, a light at the end of the tunnel in the scheme of things, Bob.
Well, there are a lot of other branches to don't panic. It's been a long time. We've been doing this for almost a year. As Larry talked about the self-care, ask for help if you need help, talk to your friends, talk to professionals if you feel the need to go in that direction and there's no stigma to it. Our folks have done this remarkable, starting from when we shut down and took a week and turned everything around on a dime. The honest part of the conversation is it could get a little worse before it gets better. There is a new variant. The UK variant is out there. We're doing a pretty good job in Rhode Island. I know that's hard for some folks to even believe, and we're not doing a good job with vaccine distribution right now. We got an F grade, probably deserved an F grade. We will get that grade up as more and more resources come online. We are doing one of the better jobs in the country with testing, including most of our school districts that are open either fully or in hybrid fashion have robust testing systems in place. We were heartened to hear that at our board meeting this past Monday. And the key with the upcoming new variants is to, as quickly as possible, identify any place there's a strain and get folks into quarantine and isolated and get on top of it. It's always a tricky balancing act out there. I err on the side of caution on these things. We see that the state is opening things up more. That doesn't mean, don't wear the mask. I mentioned earlier that there's better masking or double masking is the new recommendation, so follow it. Try not to get in fights with people who don't understand the arrows on the floor in the aisles in the supermarket mean go this way. Avoid the people without the mask. Don't try and take them on in an argument. And we're getting close. We're getting close. We could have a great summer. We could have a great summer. Just the contrast, we're going to appreciate things a little bit more. So that, it's kind of it's a cautionary pep talk.
It's a hang in there.
As someone who has never run a marathon, but who listens to people like Larry who have, I think we're at the Heartbreak Hill part of the Boston Marathon, which means we're, 20 miles in, and it's going to be a little rough for that last part, but then the goal will be in sight, and we are closer to the finish line than we are to the starting line. And all those people who are running with us are still running with us. So that's my analogy, not based on personal experience, just listening to the stories of those who are much more athletic than I am. How's that, Larry, for using one of your?
Well, that was pretty good, Bob. I would use that we're at about mile 20 and we've started to hit the wall because it's been such a long time and a long run. But if you can push yourself through the wall, you get to the end and you're rewarded. So that's, up Heartbreak Hill, the wall's almost there. So yeah, those are good analogies. And I know what our members have gone through and how hard they worked. And I hear it from every state president, just talking about how wonderful our members are and what they've done. In our meetings, both Bob and I hear it from around the country, and certainly here in Rhode Island. It's just, I say I'm in awe of what our members have done to keep education and to keep the state going. Think about what our members at the Department of Health have done. But yeah, we're going to get there, and it could be a good summer. Good summer.
I had asked my daughter, who will be 8 shortly, I said, is there something you want to try to accomplish this year? Is there anything that you're really looking forward to? And all she said was, I want a perfect beach day. I want to be on the beach, having one of those perfect nights where you're there till like 10 o'clock at night. We have like a pizza that we bring with us. So that's what I'm looking toward with my 7-year-old, that we can get there and have a good, safe, relaxing summer. We got to get through the next few months first.
A perfect day is a good P to end on, right?
It is a good P to end on. Yes. Thank you both very much.
Thank you.
Thank both of you, and all the folks who are watching are still hanging with us. We're not doing these every week anymore because we were getting a little redundant, but we're doing them as needed. And we won't do one next week because we're going to try and follow the idea of giving everyone a little time off. And but we'll be back with more news.
We will. Thank you.
Thanks.
Thanks.